Dr. Auerbach, in your office you do also braces, and I think you do, kind of more or less all types of braces. There's what we call the original and the regular braces, even though they have advanced drastically from the old days, and I want you to tell us about it. And then you also do what is even a more modern one called like Invisalign, and again, there are some brands out there who do that, but basically where braces are for all purpose not visible, and I want you to tell us about all procedures. Are all procedures good for every mouth, and what is it, and what are some of the advantages or disadvantages in either one of them?
Sure. Well, a lot of people just look at the teeth to make them straight. I look at also the bites and the jaws, how they line up. And so that's important. So we'll start some kids as young as 4 or 5 years old to correct some bite issues. So that's some advantages to the traditional or the regular orthodontics that you were mentioning, because the Invisalign won't start a case like that. What Invisalign is a clear tray that fits over your teeth. And what that does is it's a little straighter than your actual teeth. So when you put it in, it forces the teeth into the alignment of the tray. And then every 2 to 3 weeks, you put in a new tray where the teeth are a little straighter in the tray. So the teeth get straighter and straighter each time you put a new tray in. The traditional or the regular orthodontics is you put a bracket, you glue it to the tooth, you put a wire in there, and when you can make the tooth move to the straightness of the wire, you get the teeth to be straighter too. So those are how they are. Now, the advantages of the Invisalign or the clear trays that fit over the teeth are they can be removed so that you can clean your teeth really well, which is important, so you don't get gum disease, so you don't get cavities. So they're very nice. The advantages of the traditional, the regular braces are, some kids, maybe the parents want the teeth straighter and the kids don't. Well, if they have something that they can take out of their mouth, they may not wear it. So there are advantages to having something that's always there, so it's always working. So that's why we offer both and are able to do both, and we get great results with them.
Great. Is there a difference in, let's just say, same case, who clinically qualifies for the normal braces and the Invisalign? Is there any time difference of how fast the case will be done if you use one or the other? Is Invisalign slightly faster, slightly slower, or is it pretty much the same, give or take? What are we talking about?
Well, on an average, they're about the same. There are different cases that if a tooth has to move a long way and it's crowded out where the tray may not fit as nicely in the beginning, it may take longer because you can only move a tooth, a couple tenths of a millimeter with the tray, whereas putting a wire on something that's that far out of alignment within, a couple of months can be moved a lot farther. So it's case by case, but on an average, they're about the same.
Got it. Provided the person is wearing the tray as he should, which is
right.
Pretty much all the time except eating, I guess, right?
Yeah, eating and cleaning your teeth. So we'd like, about 22 hours of wear every day to keep the teeth moving.
But it looks to me like a very big advantage that you can or must take your braces off while eating and cleaning, because if you don't, that little wire serves as a flag with the spinach flag, and again. If you're just a tiny bit sloppy and busy, whatever you want to call it, and you're not brushing very tedious, which is a lot of time, you might have straight teeth, and when you take off the braces, you might have gum disease and stuff like that, or otherwise colored teeth because they're not so nicely brushed, and where you had that little brace on it, there the colors do the same. Is that true?
Yeah, because what happens is acids, whether it's from food or the bacteria that in your mouth produce them, that acid softens the tooth structure and can demineralize it and end up like a white spot. So sometimes you'll see people who've had braces and they have these little, white almost squares where the bracket was stuck. The bracket where it was glued actually protected the tooth from the acid, and the acid sat around there because it wasn't cleaned very well.
Right.
So it's a big advantage to be able to take it off and clean it.
And as you mentioned in another video about how how bad gum disease is, so the last thing you want is one of those 14, 15, 16 years old, for that much 31-old, develop any type of gum disease during the time of straightening out the teeth. That's just not something you want, right?
Right, yeah. We recommend they come in every 3 months when they have braces on so that we can keep the gum disease and keep the teeth healthy, keep it out of getting problems. Do more adults, use the Invisalign than the younger ones? Kind of like the adults more caring, more kind of like preferring the Invisalign? Yes, I think some of the issues with the younger kids or the teenagers, the parents may not think that the kids will wear them. So that's why we do more of the traditional regular braces on the teenagers. But we do some Invisalign cases too. And most of the adults don't want to show the braces. So I would say most of those go for the Invisalign because it's less noticeable for them.
And as of course, when the kids wear the Invisalign, they cannot wear their school color on it, but, on those new braces where they have all kinds of little, things they can put on, right?
Right. We do have some kids that are begging their parents to get the braces so they can get these little colored rubber bands on the teeth. What those rubber bands do is they hold the wire into the bracket. Unfortunately, though, after they've had them on for a few months, they're now like, when can we get them off? So it's exciting in the beginning for them, but it does wear off that excitement.
Sure. Dr. Auerbach, are those Invisalign braces, are they really invisible? I mean, if I wear them and speak to you in, normal speaking distance, 3, 4, 5 feet, can you see them or not? I mean, you're a dentist, you probably can, but a normal person.
Normally, it's hard to find that they're there. They really blend in. They're basically clear, so you just see the teeth through them. If you're at a speaking distance, 3, 4, 5 feet, you basically, unless you're looking closely to see if they have anything on their teeth, you won't just notice them.
Beautiful. Now, let's assume a person, let's say some 30, 35 year, anyway, any person wears those Invisalign because he wanted to get his teeth straightened out. He didn't want to go for veneers and lumineers and grind them down. He just, he loves the rest of the teeth, so he just wants them straightened out a little bit. But at the beginning, he's a little self-conscious. So he has this first date, or he has this great job interview, or this business deal where he meets Mr. Super Important. And if he, for that one afternoon meeting, etc., takes his braces out and puts them in a pocket, not the end of the world.
You mean the Invisalign trays, if he took them out for a little bit?
Yeah.
No, it's not the end of the world. If somebody has a job where they just are eating or something all day, I don't know, maybe a tester, we would just have to go longer. Instead of maybe switching the trays in 2 weeks, maybe we'd have to go 3 or 4. So it's not a big deal to have them out for a little bit at a time. But keep in mind that the more they're in, the quicker it will go because it's moving the teeth. The teeth are moving through the bone. The bone has to remodel, and it takes time for that to happen. Absolutely. If you have them out for more than 4 or 5 hours, the bone kind of stops its remodeling process, and you have to kind of gear up and start that up again. So instead of just losing 4 hours, you lose 8 hours because the body stopped working, and it has to re-gear up and start working. So you definitely want to keep them in as much as possible.
Just like as I said, and usually, since you say there's really invisible, after a while the person will notice that really nobody, sees it. But let's just say at the beginning, or as I said, there's that one time here and there where he thinks that he just wants to go without it. It's probably okay. And what about if, let's say a kid, or for that much an adult, he loses one? He puts it there for eating, falls down, steps on it, or just runs away chasing that girl, and next thing you know is it goes, oops, I forgot my, my trays, goes back to the lounge room and nothing there anymore. It's in a garbage can somewhere. What happens then?
Unfortunately, that does happen. We have them keep their previous tray, so they could put that in until they get in to see us. We could either order a new aligner. For the teenagers, they actually will allow that. with no additional fees. If it's the regular liners, then it might be a small cost. But we also may be able to move on to the next tray. If the patient calls us right away, we have them come in. We'll try in the next aligner and make sure everything's fitting okay, and we can just continue on. So it's not a big deal, but we do want to address it right away, whether they put in their previous aligner or they move on to the next one. We want to get something in to keep the process going.
Right. Okay, good. So he goes back to the old one. Maybe he advances to the new one because it's already void already a little bit, or somehow it works. It's something you can then decide, and or a new one gets made in a couple of days while he wears the old one usually, right?
Correct.
Well, all right. Yeah. Here we have it. So basically,
now a side note on that, basically we give them a little tray so that they won't wrap it in a napkin and throw it away. So as long as they have that tray, they put that in, it's much easier. It doesn't get damaged because it protects them, and it reminds them to pick it up so that they don't throw it away in a napkin. So
right.
That's,
and the
you definitely want to keep that tray with you.
The janitor who cleans the table might also notice that this is not something different and puts it aside.
Right.
Exactly. Well, all right. Wonderful. Thank you very much, Dr. Auerbach.